In this podcast episode, Dr. Elizabeth Poynor, a gynecologist and cancer specialist, delves into the hormonal changes women experience throughout their 30s, 40s, and 50s. The conversation explores the physiological shifts during these midlife years, the impact on fertility, brain, metabolic, and cardiac health, and the often overlooked symptoms that women face. Dr. Poynor also discusses hormone therapy, lifestyle interventions, the complexity of diagnosis, the interplay of environment on hormonal health, and the expanding field of longevity and women's health education. Dr. Poynor opens by outlining the subtle but real hormonal fluctuations beginning in women's late reproductive years, particularly between ages 35 and 45. During this time, ovarian reserve diminishes, leading to less regular ovulatory cycles, lower progesterone, and fluctuating estrogen levels. These changes extend beyond fertility, affecting brain function, metabolism, and cardiovascular health. Insulin resistance may emerge, visceral fat accumulates, and mood alterations like irritability and fatigue start subtly before the onset of full perimenopause. This phase is often misunderstood, leaving many women feeling unlike themselves without clear acknowledgement from the medical community. The perimenopausal transition brings cognitive symptoms such as brain fog, memory lapses, and word-finding difficulties. These are tied to fluctuating estrogen levels affecting brain energy metabolism, vascular supply, and potentially the early development of plaques associated with dementia. Metabolic changes accompany these brain shifts, including increasing insulin resistance and an unfavorable shift in body composition marked by visceral fat gain and muscle loss, sarcopenia. Sleep disturbances and mood variability further complicate this transition, contributing to diminished self-confidence and social withdrawal. Dr. Poynor emphasizes that these hormonal changes influence multiple body systems and should not be dismissed as just getting older. Given the overlap of symptoms with other medical conditions, Dr. Poynor stresses the importance of a thorough differential diagnosis when women present with fatigue, weight gain, mood changes, or cognitive complaints. Conditions such as thyroid dysfunction, cancer, or cardiovascular disease must be ruled out. This careful evaluation prevents misattribution of symptoms solely to hormonal changes and ensures appropriate treatment pathways. Hormone replacement therapy, HRT, more recently termed menopausal hormone support, remains a central topic. Dr. Poynor advocates for the use of modern transdermal estradiol and natural progesterone formulations, which differ significantly from the older oral conjugated equine estrogens and synthetic progestins that were linked to increased risks in past studies, like the Women's Health Initiative. Contemporary preparations avoid inflammatory estrone, reduce clotting risks, and offer a safer profile. Early initiation of hormone support, even pre-symptomatically, shows promise in protecting brain, metabolic, bone, and cardiac health, shifting the view from merely symptom relief to physiological preservation. Women with genetic predispositions to cancer, including BRCA1 mutations, are not automatically disqualified from hormone therapy. Dr. Poynor shares personal insights as a BRCA1 positive survivor who continues hormone support cautiously. However, women with a history of estrogen-dependent cancers like breast cancer are generally advised against systemic hormone use due to potential cancer recurrence risks. Cardiovascular history, such as previous stroke or heart attack, also necessitates careful consultation with specialists. Local vaginal estrogen therapy remains safe even for high-risk individuals, especially for symptoms like vaginal dryness and painful intercourse. Monitoring hormone fluctuations is challenging due to their dynamic nature during midlife. Standard hormonal blood tests, such as day 3 follicle-stimulating hormone, FSH, can provide some insights, but are imperfect snapshots. Emerging home testing platforms like Dutch urine hormone panels and integration with wearable devices may help build comprehensive hormonal profiles. Combining these objective measures with patient narratives and symptoms could guide personalized treatment strategies in the future. Estrogen exposure over a woman's lifetime correlates with a reduced risk of dementia. Initiating menopausal hormone support within a critical window around menopause may lower Alzheimer's risk by about 30%. Fluctuating estrogen disrupts mitochondrial function and glucose metabolism in brain cells, triggering cognitive symptoms. Dr. Poynor points out ongoing investigations using advanced imaging and brain biomarkers to evaluate how transdermal estrogen affects brain structure and function. However, starting hormone therapy late in life, after age 60, may have differing effects depending on the formulation and individual context. Dr. Poynor highlights midlife as a pivotal opportunity for women to decide how they want to age, emphasizing agency in health optimization. Movement, nutrition, and sleep are pillars of maintaining vitality. Strength training is crucial to counteract muscle loss, with recommendations for protein intake higher than many women traditionally consume. Sleep quality significantly influences metabolism, mood, and weight management. Stress management and social connectivity, including purpose and mindset, are also key factors in sustaining well-being during midlife. For women unable to use estrogen, such as cancer survivors, alternative treatments exist for vasomotor symptoms. Central nervous system acting medications like Vioxx have been developed to alleviate hot flashes without hormone exposure. GLP-1 receptor agonists, originally used for diabetes and obesity, show promise in addressing midlife insulin resistance and visceral fat accumulation. These agents can also reduce the food-related hunger noise exacerbated by hormonal shifts, assisting women who struggle with weight despite lifestyle efforts. Acknowledging the role of environmental toxins, Dr. Poynor advises minimizing exposure to endocrine disruptors like phthalates, BPA, parabens, and pesticides. Simple steps such as avoiding plastic containers, using phthalate-free cosmetics, and filtering water can reduce harmful chemical exposures, supporting hormonal balance. However, she cautions against obsessiveness, encouraging a balanced, sustainable approach to environmental health. The episode touches on the broader field of longevity science, underscoring the need for rigorous data and clinical trials rather than hype. Foundational health behaviors, including regular medical screenings and lifestyle adherence, remain the cornerstone of healthy aging. Experimental therapies like NAD supplementation, peptides, spermidine, and others are under investigation but require more evidence. Dr. Poynor is particularly interested in GLP-1's anti-inflammatory properties, noting their potential to modulate aging processes linked to inflammation and mitochondrial dysfunction. Dr. Poynor addresses men's understanding of midlife hormonal transitions, encouraging empathy and education. Recognizing that women's mood, libido, and energy fluctuations during perimenopause and menopause are physiological, not relationship-based issues, can improve support. Men are urged to advocate for their partner's health, encouraging timely specialist care and open communication. To bridge gaps in clinical knowledge and patient experience, Dr. Poynor recently launched the podcast Decoding Women's Health, featuring experts across specialties to deliver medically accurate and accessible information. She emphasizes the need for a progressive, science-driven dialogue that integrates patient narratives with rigorous evidence, aiming to empower women and update healthcare practice. Throughout the discussion, Dr. Poynor underscores the reality and validity of midlife symptoms, advocating for recognition, diagnosis, and treatment tailored to individual needs. She encourages women to listen to their bodies, seek knowledgeable healthcare providers familiar with hormone support, and embrace lifestyle choices that nurture long-term health. Agency, education, and a multifaceted approach to wellness form the foundation for thriving through hormonal transitions and beyond.